I think as we move from volume to value, part of the value equation is the patient experience and actually the staff experience too, because I think they're connected. And I think volunteers, in my experience, in health institutions play an incredibly important role in lifting the spirits of everyone just through their energy and compassion. And that actually reflects on things like CAP scores. So I would believe that the volunteers are instrumental in being a partner in the move towards value in the sense of providing compassionate patient care that can be measured and appreciated by the people who pay the bill. The first thing is to recognize that their role is important and to identify that they're a key part of the care continuum and the institution. I mean, I think many CEOs I talk to will, if you pardon the pun, will voluntarily point to their volunteers and to their philanthropic arm as something they're most proud of the fact that they've got very active engagement from people from the community who want to help and want to identify with the hospital. So I think the first thing is just recognizing that you have a strategic resource, an ally in that. I think what's interesting though is how best to deploy them. And I wouldn't say I'm a deep expert in that, but I think finding the right sort of areas of responsibility I think is a challenge as we shift from volume to value. I'll give you a concrete example. We're moving to bundled payment. And what that really means is we've got to pay attention across the continuum of care. Other countries make use of volunteers in things like transportation services for patients. And I wonder whether there isn't an opportunity as we think about, for example, a bundled payment initiative where people are being moved from hospitals to skilled nursing facilities, the volunteers might play some role. Now, I'm sure that there's all kinds of HIPAA issues and legal issues, and that's way above my pay grade, but I would encourage leaders in the field to think about that there may be real opportunities to use caring volunteers as a mechanism to improve both quality and reduce cost of services across the continuum of care. Britain, for example, uses transportation volunteers to move patients who, for example, are getting cancer treatment if they live in a remote village and are moving to a bigger center for the cancer care to transport and escort those patients to other places. And I'm aware that those kind of programs exist in other countries as well. In some countries, I mean, I did my doctorate and spent 7 years in Canada, and my son was born with a slight, an extra little digit, and a polydactylism, and had to have an operation. And the Children's Hospital in Vancouver had a care by parent unit, which is a different form of volunteerism, which is basically trying to draw in families as volunteers to be active in the care business. So I think I would be thinking about defining our definition of volunteers to include family members and sort of related folk who want to help out in the care of the patient. That's where there is potential. If you look, I mean, just to tie it back to those heavy users, I mean, a good friend of mine, Arnie Milstein at Stanford, this new, who's a physician, has this new center, about 5 years old now, where he's bringing together a whole series of fellows, most of them trained in medicine and some other discipline like systems engineering, to try and identify higher value care alternatives which are much higher performing and much lower cost. And when he started his initiative, I helped facilitate one of the first discussions he had with national experts around the issues that of these high-cost cases, people like the frail elderly or patients who are in the last year of life or multiply comorbid patients. And what he identified is that a lot of the costs and the failures were handovers. And I think the punchline in all the cases we examined with these national experts was having people who might not necessarily be trained healthcare professionals, but caring involved people, potentially volunteers, who could be very helpful in things like the transitions of care, to home, and coming at it from kind of more of a social work perspective than a medical care perspective, as you said. I sit on the board of a hospital, the Martin Luther King Hospital in Los Angeles, that's just recently reopened, and proud to do that. I salute my fellow trustees of our organizations because it is a serious commitment and an important commitment. And I think volunteers, particularly volunteers who simultaneously experience the patient care environment, as if they're participating as volunteers in the hospital or in the health system, and participating at the board level, that is a really powerful window into what's going on and what kind of care experience the institution is providing.